So what I will talk about quite briefly is our national human rights institution and the rights of older persons, and especially in the light of participation of NGOs and older people in general in our work. So I would like to try and highlight how the ways in which NHRIs can cooperate with NGOs in order to promote the economic and social rights. And also I would like to tell you a bit about the experiences from Finnish NGOs of the way COVID-19 has until now affected older people in Finland. So first of all, in general, about our work in the Finnish Human Rights Centre, this concentrating on older persons' rights is quite a new thing for us. Last year, we had meetings with several key organizations in the field of older persons. That was in 2019. And there were some top issues that came up with in all those meetings. They were negative attitudes towards the elderly, financial problems, and also violence against older people, lack of sufficient and suitable services, and challenges posed by digitalization. In a way, 1 year ago, the situation was very, very different from what it is now. There were big problems in care homes in Finland, but there was also this era of hope in a way. There was lots of talk about older persons' rights, and we all in the field were quite confident that this is the beginning of new and great development in the area. We will see how it goes, and we shall discuss that a bit in relation with the COVID situation. Well, anyway, after we had those meetings with NGOs, we started working together with them in these fields of question that were arisen. We had training and events. For example, we have this big seminar on rights of older persons. And what I feel is the most important thing in Finland when you think of organizations and then NHRIs is that organizations for older persons, they work in relatively concrete ways. They support older people in different fields, for example, digitalization or violence against older people, but they don't have a very rights-based, let alone human rights-based approach. So that is something that we want to give the organizations. We want to give them tools. And on the other hand, we're of course also on the receiving end, because the organizations give us very valuable information on the reality of lives of older persons in the field, or their lives, their homes in the world, and also information on those several innumerable wonderful activities that NGOs have to concretely improve the lives of older people. So we feel that this cooperation we have now is very valuable and very important, and might be the beginning of something great. Then we have this form of cooperation which is more structural. It has to do with this quite complex way that Finnish National Human Rights Institution is put up. That is, we have the Human Rights Centre, where I work, we have the Human Rights Delegation, and the Office of the Parliamentary Ombudsman, and all these together form the NHRI. The Human Rights Delegation is a cooperative body in the field of human rights and fundamental rights. It takes part in decision making, as in what we do here in the Human Rights Centre, and it has very good discussions, and also it gives statements, and almost every authority that is important in the field of human rights is in the delegation. But there are also very many NGO representatives. But up till now, there haven't been that many persons from the field of rights of older persons. So what we did now, when we have a new delegation, we took great care to pick up those people who have knowledge on older persons' rights. So very many of them were taken to the delegation. Researchers, different authorities, NGOs, and so on, or NGO representatives. And also we will have a new special division in the delegation that will concentrate solely on rights of older people. And in that way, we hope to have this, as I said, more structural cooperation and not sporadic. And then, so that I won't use all the time, we shall go to COVID-19 and older people in Finland and NGOs' experiences. We did not have the possibility to have this big survey on how COVID-19 has shown itself in the lives of older people, but we did have this informal overview of organizations for older people and asked for their experiences on the impacts of COVID-19. And the ones that gave the, well, broadest answers were the Alzheimer's Society, Carers Finland, and the Finnish Union for Senior Services. And what they had found out were, I suppose, very many very similar things than in other countries. There were problems in services, lack of protective equipment, for example, and COVID-19 spreading in care homes, that kind of things. There are especially vulnerable groups, most importantly maybe the persons with memory-related diseases, who are especially affected because, first of all, they don't understand necessarily the situation, so they experience great stress. And on the other hand, they are very often in need of almost constant care or services, so they are principally affected of the problems in services, and also they are in greater danger than many other people of getting COVID-19 and also dying from it, since they are mostly old people. Other concern is the treatment and rehabilitation of the underlying disease during the pandemic, so that it wouldn't be only COVID-19 that we are tracking and trying to cure. Great concern situation of older people after the pandemic, because, as I said, the situation of older persons, especially in services, has been a great discussion for months and months in Finland. And now, of course, everybody fears that nothing will come out of it, now that the economic situation is as it is and will not get better, and there will be many ways to use money in the years to come. Also, some old persons have found it a violation of their rights to be forbidden to meet other people. So they find that this is something that should not be done, and maybe is not sufficiently legally maybe explained to them. Because in Finland, at least, we have this thing that persons over 70 years old are in a quarantine-like situation. So that is something that some members of some NGOs have thought is a great violation of their rights. So they don't consider it to be something that will keep them safe, but something that hurts them. And also there's this problem of equal access to information, since the problems of digitalization are not getting lesser during the pandemic, but of course they are bigger now, since people can't really see eye to eye, but we are mostly operating in the internet. Here there are some links. We have in the Human Rights Centre, we have gathered quite a lot of information, and also it's also in English on rights of older people in general, then rights of older persons and persons with disabilities and COVID-19. And also we have a page on equal right to medical care, which of course has a well, it's very meaningful when you think of the prioritizations and the fear of some persons not to get enough or sufficient care, for example, for being old. So I think it will be possible to get these PowerPoints afterwards. And then to finish, I would just say a few words about the work of the Office of the Parliamentary Ombudsman, because as I said, is part of our NHRI. Unfortunately, Lotta Hämeenanttila, who works at the Parliamentary Ombudsman as an expert on older persons' rights, could not participate today. She was supposed to, but I promised her to tell some things. Maybe most importantly, there has been this big initiative of the Deputy Parliamentary Ombudsman who has sent this questionnaire for municipalities on several questions regarding the pandemic and its effects. So how has it affected services for those who are in care homes? How do the municipalities supervise the services during the pandemic? What measures have been taken to ensure the dignity of persons with memory-related diseases in times of pandemic, and what's the process when a resident in a care home is infected by COVID-19? And this has also a bearing with intensive care. And there have been other measures also in the Ombudsman's office. Many complaints are under work, mostly about social and health services. There are other initiatives, for example, on extra measures that should be taken when locking doors in care homes by virtue of Epidemic Act, because this is now done. And inspections are going to be made, even though people are not supposed to go to care homes, but it is thought that it's very dangerous also not to go. So the plan is now to get the needed protective gear and do the inspections in spite of the pandemic, also during the pandemic. So here was my presentation. Thanks for listening. Hope you're there.
Thank you so much.
And if I understood correctly, we will have the discussions later and continue straight on with Nena Georgansi, isn't it so?
Yes, thanks. I'll share my screen then now. Let me see. Can you see my screen? Hopefully that's the case.
Yes.
Thank you. Okay, thanks so much for the opportunity. I'm Nena Georgansi. I'm Policy Coordinator for Human Rights and Non-Discrimination in Age Platform Europe. I wanted to use the time that we have today to introduce a bit Age and our membership organizations, because as I understand, the objective of this webinar is to build synergies between organizations of older persons and NHRIs on the ground. And I will just introduce some of the key human rights challenges that we identify in general and in the context of COVID-19. But of course, the list will not be exhaustive, but hopefully we can reflect more on that during the discussion. So Age Platform Europe is a civil society network. We have member organizations across mainly EU member states. We have more than 100 member organizations. And the aim of the organization is to be the voice of older persons across all the EU and international debates that we follow. Of course, as a membership organization, we also support and build the capacity of our members, and we advocate and promote equal rights in older age. Now, I wanted you to have a little bit of better idea of our member organizations on the ground. We have 3 of our members listening to this webinar, one from Ireland, from the UK, and from Belgium. So they will be able to give their reflections later on during the discussion. But I wanted to let you know that the organizations that we have in our network are very, very diverse. We have from very small, mainly volunteer-based organizations to larger, relatively better resourced organizations with employed staff. We have organizations that are focusing to people still in the labor market that might be experiencing discrimination as older workers, so people in their 40 plus or 50 plus. We have organizations that primarily focus on what we call the 4th age, so people who might develop some sort of functional limitation and might need care and assistance in the daily living, but also in the majority, I think most organizations address a wide spectrum of issues affecting in particular people after retirement, but not necessarily only. So the topics that our membership organization and by extension ourselves are covering are also very wide. Anything, like I said, from employment all the way to care, but also more not only traditional issues like pensions and care, but also issues like active citizenship, digital inclusion, volunteering, issues like elder abuse and neglect, of course, and other human rights and equality issues. The majority of our members, and this is perhaps very relevant for you to know, is that they are self-advocacy organizations, which means that they are governed and directed by older persons themselves. And I think this is what gives them a real added value in terms of that they have a real life experience of aging. And even those that do not, are not self-advocacy organizations, they directly engage with older people on the ground. And our membership organization, of course, are interested in defending their own rights at the moment, but they very much also looking into long-term reforms and the impact of policies in the long term. So they're very much looking into issues of sustainability, but also intergenerational fairness and solidarity. And of course, like many NGOs, they have limited capacities in terms of human and financial resources, but they do count at the same time with a committed staff and members and volunteers. Now, what is particularly relevant in this discussion, and I have noted here as a weakness, but I think it's also an opportunity, is that our members in their majority do not have human rights expertise. So they are not necessarily familiar with the human rights framework, and most of them do not have any experience, for example, with doing any strategic litigation, with doing parallel reports to human rights bodies, being in contact with human rights experts, and so on. So this is where I think the collaboration with NHRIs is key, precisely because most NGOs working in the field of aging do not have this expertise, do not work with the tools and the human rights-based approach. We end up having very little visibility of older people's issues within the existing human rights framework. And this is where I think it will be really important to build synergies between NHRIs that have this expertise and organizations of older persons that have the expertise on the ground of what are the real human rights challenges in older age, to advance this more using already the existing framework and processes. And indeed, we have at the moment specific provisions on the rights of the elderly, both in the European Social Charter and the Charter of Fundamental Rights, which I think are probably underused. We have the EU Employment Directive, and we have the Council of Europe recommendation that was adopted in 2014. And there is, of course, also the UN open-ended working group on aging that is looking at ways to strengthen the protection of the human rights of older persons and the feasibility and added value of a new convention. So these are opportunities to bring more visibility to these issues affecting older persons' rights. At the same time, we know that the framework that we have at the moment is incomplete. So, for example, we do not have a general prohibition of age discrimination covering all spheres of life. Instead, we have in the interpretation by human rights bodies and courts and experts, several exceptions, I would say, to the rule of age equality. And systematically, older persons' rights tend to be let's say, deprioritized. To give you one example, To date, the European Commission has never included the rights of older persons or age discrimination as a priority or as a specific action point in their work plan, compared with other groups and other grounds of discrimination. And we also have, in general, lack of data around older persons, which makes it difficult to monitor their situation on the ground and the level of enjoyment of their human rights. There are age limits, there are gaps in data, and so on. And I have noted here COVID-19 both as a threat and an opportunity. Of course, COVID-19 is a threat to human rights of older persons, among other groups, but it is also an opportunity, I think, because it has increased the visibility of older persons in general, but also as rights holders. And what I would like to discuss with you is the level to which you think we can sustain this interest in the future and use this to improve the protection of the human rights of older persons in the future. Now, what is our motto and our message is that we all have the same rights, and these rights should not diminish with age. But as it has been stated by several experts, the Fundamental Rights Agency, but also the UN Open-Ended Working Group on Aging, although in principle we all have the same rights, in reality we see our rights diminish when we get older. And this is due to negative notions around what is older age and what are older persons like. So this is essentially ageism, and of course ageism exists not only for older persons but also for younger groups. But of course in this context I'm more interested in the older age group. There are several definitions of ageism. I will not get into that, but essentially an easy definition of that is how we think, how we feel, and how we act towards older people, which is the definition that has also been adopted by the World Health Organization that has launched a global campaign against ageism. And ageism is key. In our work, we see ageism both as by itself as a violation of human rights. So we see it as undermining the equal and inherent dignity of older persons, but also as a driver of other human rights violations. So it is, according to a recent Eurobarometer, the most widespread form of discrimination. And what makes it distinct compared to other grounds of discrimination, it is that it's largely socially accepted. So we see age discrimination being justified in cases where discrimination on other grounds like race, gender, or disability is not justified, it's not accepted. Examples like this include age limits in health prevention, insurance, mandatory retirement benefits, age limits in accessing disability benefits like mobility allowance, like personal assistance, and so on, even in training. And the COVID-19 crisis has just exacerbated and brought more to the fore the existing inequalities that older persons have been facing, and also some of the systemic deficiencies that we have in systems like the care system in our societies. So we have recently launched a paper on the human rights concern around older persons in this context. And here again, we see ageism playing a huge role, where we have seen age being used by several countries in official protocols as a basis for allocation of scarce resources. So in terms of who gets intensive care, many countries have now revised their protocols, but there are still some that use age as a basis or age as a proxy for the allocation of resources. The crisis has also exacerbated and intensified hate speech in older persons. We have seen terms like boomer remover and older persons as bed blockers, and people dying like flies, and other pejorative terms appear in social media and used by journalists across Europe. We have seen even cases of people intentionally coughing on or spitting on older persons just to see their terrified faces. And we have seen also measures being introduced on the basis of age criteria, or discussions happening at the moment about extending confinement only for a specific part of the population on the basis of their old age. Now, several of our members, and of course as you know, measures taken as a response to COVID-19 will vary largely on the member state and the local context, but several of our members have found such measures that are based on age criteria to be discriminatory. Because essentially they exclude older persons from the deconfinement, let's say, measures, and they assume that all older persons are the same, that they are in a homogeneous group, that they are all vulnerable. In reality, many older persons, if not most of them, are still active. Many still work, they volunteer, they provide caregiving to several of their families, and they do not necessarily have underlying conditions. So they're not necessarily, so age is not, let's say, the most useful criteria for them. But what I think is most concerning in these discussions is that often these plans for extending confinement for this group have taken place without consulting older persons, without consulting their representative organizations, and without even considering what measures need to be further adopted to support this population and to mitigate some of the adverse impact of long-term confinement in their physical and mental health. And of course, the most alarming cases we have seen in care settings, where we've seen neglect and abuse. Sanna has referred to that as well, in terms of lacking protective equipment for the staff and the residents, which has allowed COVID-19 to spread. But also we have seen, unfortunately, because in a sector that was already suffering before this crisis, due to lack of workforce, due to untrained, unqualified and underpaid workforce, we have seen that now that the workforce staff may be affected, may be sick, or need to self-isolate. So there are less people to take care of the residents. Older people have been abandoned, have been neglected. They have been left to die alone. In many cases, in some countries, older persons in institutions are not even transferred to hospital care to receive treatment. So they're just on the account that they are being old and that they need care, they do not have the same right to health treatment. We have seen cases where, because older persons are completely, they do not have even access to those technological means that the rest of us have to communicate with their families, they become depressed, they deny to eat, so they end up having their physical health deteriorating, and some of them have also died. And of course, we see also cases where their deaths are not even reported or not counted by general official statistics. So these are just some of the concerns. Of course, there are more, but I wanted to end on this more positive note about how we can work together to address this. And I'll give the floor to Kieran now to give his thoughts as well. But just from my side, in our experience, there are very few of our members that actually have a regular and open dialogue with NHRIs. Claudia will give you a good example of that. Some of our members have been in touch with their NHRI on an ad hoc basis, be it on the occasion of a project or an advocacy or a campaign. But what I would like to suggest is that you see, because I know that we all have competing priorities and limited resources, is that you try to mainstream older people's issues within your existing work. So if, for example, you're working on women's issues, try to address older people's issues. If you're working on a report to a UN committee, involve older persons on the ground. If you are planning to send a contribution to the open-ended working group on aging, make sure that you work together with older persons on the ground. And as a last note, we did a seminar last year with equality bodies, where we have also identified specific ways that equality bodies can collaborate with older persons organizations. And I think that this can be also useful, these ideas also for most of NHRIs. So that's for me, thank you. And I'll give the floor to Kieran if he wants to add his point of view in terms of how older persons organization can collaborate with NHRIs on the ground.
Thank you, Nena. I just have one point to make, which is to support your point that this is both a threat but also an opportunity. And I think for those of us, all of us as NGOs in particular, should use this as an opportunity to engage in a deep way with our national human rights institutions and rather than wagging our finger, in fact, invite people to national discussions about how, even though lockdown restrictions are well-meaning, they are still inherently ageist when we apply it as you know, as kicking in by a certain age. So in Ireland, it's if you're 70, you have to cocoon and stay at home. So if I were 69 yesterday and doing my, you know, 8K a day walk, suddenly I'm not allowed to go out because I'm 70. And I don't think any of us are suggesting that there is any malice. You know, there's no conspiracy behind this, but at the same time, it's a really good example of how ageism can really kick in even when there are good intentions behind it. So I see this as an opportunity for national discussions, hopefully before the year end, but if not, then early new year, where we use COVID-19 as a really, really concrete example for looking at how, as societies, we still treat older people as a homogenous group. So thanks very much for your presentation, Nana.
Okay, thank you, Nena. And I think there are some questions here, but I think maybe we take Claudia first, and then we have all the questions and answers afterwards. Yes, Claudia, floor is yours.
Thank you, Sanna. Thank you, Henry, for organizing this event, and I'm happy to be with you, even though I would have loved to be with you together in person. I hope you can see my presentation right now.
Yes.
Okay, perfect. Let me start like this. And I will follow up on a couple of things Nena already said. As you may know, we are working in the field of older persons as NHRI now for 10 years. So we struggled from the beginning to get some collaborators with us. We first approached a couple of NGOs, and it really took time to get engaged with each other. But right now we really have a wonderful relationship and we are working together. What I also learned from the beginning, and Nena mentioned this already, is that many NGOs working with older persons don't have a human rights-based approach, which is from one perspective quite clear, but on the other hand, they are all working with human rights. If you look exactly what they are stating and what they are arguing for, it is a human rights-based approach, even though they sometimes don't see the connection with human rights. So therefore, I would like to I will talk a little bit about how to raise awareness on different levels. I would like to talk with you about the national level, the regional level, and the international level. And I think they are all related to each other. So if we start on the national level, we have to think about who are the key stakeholders? How can we get engaged with them? First of all, as Nena already said, NGOs working already on different topics, and also Sanna raised this issue. If you're an NHRI, try to get them involved. If you're working on a paper, or if you try to raise awareness when you're approaching the UN, for example, doing a report on the human rights of not only of older persons, but of women, for example, include older women. And on the regional level, try to think how to engage them if you're doing a report for the European Union or for the Council of Europe. There are many opportunities to raise awareness for the issue. But we all have to be also aware that older persons' human rights are not a priority in most of the NHRIs and are not a priority from parliamentarians and governments. So therefore, I would really like to tell you that it is possible to find some very good collaborators in your country. But you have to disseminate the information. For example, where can they go to if there is an opportunity, for example, for the next session of the open-ended working group on aging, how get involved? Are there some good examples if we are talking about the next topics, for example, access to justice? What kind of experience do they have from the national level? How do they get their information? Nena already mentioned this. It's pretty hard today to get information if you are locked down and you don't have access to the devices. But I'm sure that there are many examples out there and we just need to link them with our human rights issues. So we have also to raise awareness at the governmental level. First, find out who's involved in the issue, try to approach them, get them involved, and have some kind of workshop or a round table, talk on the thematic issues. What kind of different experience are there? Are there already some reports from government which go in the right direction but don't have a human rights-based approach? Use them, ask them to get involved and also work with them on the normative elements. We have a wonderful cooperation with the BAXO, which is the umbrella organization of senior citizens, NGOs in Germany. We work together on a it's a workshop and it starts every year right now in advance of the open-ended working group. We did this already. So we had a workshop on the access to justice, for example, and we tried to get involved not only the ministry who's in charge of the open-ended working group, so we also tried to get involved the Ministry of Justice, even though they were not so happy to discuss these kind of issues with us, because we, from a human rights-based approach, have a very broad approach. What is access to justice? And they have a very narrow one. So this is also a kind of opportunity to link your ideas with the ideas of the government and also bring in civil society organizations so they fill the discussion with their examples from the national level, from the ground. So they have the knowledge what is really going on the ground. So maybe you know already that before the open-ended working group starts its session, there are questionnaires. So this is also an opportunity to bring non-governmental organizations into the picture. Send the questionnaires to them, ask them to fill them in from their perspective, and then you can also discuss this. What are the differences? Do they need some more information, or how can we get this broad knowledge together? What we can also do is to strengthen the human rights of older persons, release statements to international days, use them as an opportunity to raise awareness, to show that there is much more there, and not all the older persons are frail and vulnerable. They all are very active. They're a positive part of society, and I think this is something which was not shown when we also discussed COVID-19, because many older persons which have been working in the field of medical sources were asked to come back. They had a higher risk and they came back to join the forces, to work with them. And I didn't hear much to really thank them that they took the risk to get involved and to make it sure that there is solidarity. I would say that in these all different ways, Nena showed many examples of violations of human rights, that a convention would make a difference because people would be much more aware about the human rights of older persons. For example, as we all know, the right to care is not a real right in the human rights system. So if we talk about long-term care as a right, we always need to refer to other rights. Therefore, I would say it really makes a big difference. As I already said, it would be also good to get active on the regional level. Therefore, we should involve our network coordinators. As NHRIs, we have NRI on the European level, but we also have network coordinators on all the other different regions. We also need to link each other, because as maybe a couple of you might heard, there was a big conference on human rights of older persons in Africa last year. But we only got the knowledge and what was discussed there afterwards. So we couldn't support them, we couldn't spread the message. So this was not a good example of coordinating our networks. So therefore, I would really like to say once again, we need to reach out and get the others involved and work together on joint statements, because there are many same issues. We can work together and raise awareness through our networks, and then also go to the open-ended working group for aging, for example, and present our findings, what we have found through the last years. As I already said, the international activities. I will refer to the open-ended working group, but there is also the Council in Geneva. We also should go there and bring our knowledge to the discussions when it tackles with different groups, for example. Now, if we think about, there are discussions going on for people with disabilities, but nobody really cares about the group of older persons with disabilities, or the other way around, persons with disabilities who are getting older and older, because they are not used to this focus. So we should raise awareness. Also, for example, if you have a statement for the Committee on Economic, Social and Cultural Rights, include older persons, not only when we are talking about social security. For example, include them when we are talking on education, because this could also be long-term education, and in the end, it is their access to the new sources. So where do they get the information? They also get their information from the World Wide Web. So they need to have access, and therefore we need a different approach to the right of education. So just to bring a couple of examples how to include older person in your regular life. So I already said that we have a chance to fill in the questionnaires, get all the NHRIs to work together. We also have a working group at the Gunnery network, but we don't have a working group on NRI. We had a very good, I would say, project. Age was also included in this on the human rights of older persons in care homes, but we didn't have a follow-up, for example. So it is a kind of lost opportunity also in this regard. But coming back to the open-ended working group, as I said, for the 11th session, we had thematic issues. It was the right to work and access to work, to the labor market. We had access to justice, and we also had two normative elements. They are regarding the examples from the last year, from the 10th session. It was the right to social security and social protection, and the normative elements on education, lifelong learning, and capacity building. In my point of view, the normative elements are the main source for us to work on, because we as NHRIs should bring the basis of these rights and the link to the life of older persons to the United Nations, and make sure and really make it more visible that this is something on the regular basis we have in each country. And older persons are not as visible in the human rights context. And we are the persons to show it much more than we did in the last years. And what I said in the beginning, we also have to approach the governments, because many of the governments, especially the ministries in the capitals, are not aware of the UN processes. This is one of our main challenges, to bring the different levels together. Because on a regular basis, if we have the UN open-ended working group, for example, in New York, we only see the stuff from New York and not from the capital. So this is something where we really have to work hard to raise awareness and tell them, you have a lot of good measures, for example. Bring them up to the international level as good examples, as cooperation. What we in Germany did also with the BAXE, with the NGO, with the umbrella organization. They brought their examples from the national level to the international level as NGO, and also government brought their examples from the national level to the international level. And to be honest, it really makes a difference if you manage, or if Germany or every state managed to bring a couple of people from the capital to New York, because they know exactly what are the examples on the ground. And they are not the diplomats who just tell us what's on their slides. I would also love to see more joint side events from the national level. Canada, for example, did a very good example in the last years. They brought together government, civil society organizations, and some experts. And it would be good if we have some kind of joint events, for example, NHRIs, NGOs, and government together, and really support the overall idea to bring good examples to the United Nations and learn from each other. Therefore, we need to ask the governments or the ministries in charge for their support, because it is really needed that they are engaged. What I already said, the challenges. I think one of the main challenges for all NHRIs is the gap between the national politics and the discussion on the international level, because those are very often different cycles. This is very visible on governmental level, but I think it's also visible on the NGO level. There are a couple of NGOs working on the national level, and there are a couple of NGOs working on the international level. Both are working with older persons, but very often they are not working together and not sharing their ideas. And so we don't get the whole picture. We only get it partly. And I think it was already very much said about COVID-19, but I fully agree that it is an opportunity for us to show that older persons' human rights are not well protected, that there are some gaps, and that we need something in a much more advanced form to protect the rights of older persons much more on the international level. I would like to thank you on the stage, and I'm really looking forward to your questions.